Hello and welcome to the CDO Magazine interview series. I am Mike Kaiser with Centric Consulting, and today I have the pleasure of talking with Bhavna Mehta, Assistant Vice President at Cincinnati Children's Hospital Medical Center. I heard in your career story a number of places where you were helping to make that happen, and how you're now tied to the organization's goals and moonshots. I guess, how do you formulate a data strategy that aligns with the organization's objectives and goals?
When I think about data strategy, I actually think about two roadmaps essentially. So one is really that's focused more on capabilities and infrastructure that is probably a little bit more enduring, right? And then the other is what initiatives, what projects are we working on? And those are interconnected and they should feed each other, inform each other. But I think it's important to treat them separately in a way that we can make progress on both of them. So like, for example, when I think about my infrastructure and capabilities roadmap, I'm thinking about people, process, technology, and data, right? And really, when I say people, or maybe let's start with technology because that's easy, right? So technology, what's the technology stack that we're going to be using? Are we going to be using on-prem, cloud? What is the tooling? But when I shift to people right there after that, it's about how are people going to leverage this, right? What is the org structure, or what are the structure that we need so that we can leverage that technology that we're implementing appropriately? What are the skill set that we need? When I talk about process, how are we going to maintain, support, add, update, right? All that kind of process. And then data, which is the fourth pillar, right? When you think about data strategy, is around how are we educating people about the data? How do we know, what are the attributes of data? What are the data elements? So how are we increasing the data literacy of the organization in general? So that's sort of from a capability perspective, that's how I think about it. And honestly, when I look at our pursuing our potential together goals, the underlying data strategy that we have there is bucketed in very similar pillars, where we are focused on creating more of the infrastructure. We're looking at implementing or working to implement a data fabric and a data mesh architecture with a focus on AI and ML, and we're using that at scale. Then our third pillar talks about data literacy and the governance and processes, and our fourth pillar is more around really modernization of our tools. So like everyone else, we're on a journey to modernize to the cloud. And then when I think about our interconnected roadmap as to what that infrastructure is going to unlock, what kind of capabilities it's unlocking, some of the projects that we're working on our command center. So our COO recently declared, or last year declared, access is our wildly important goal. So we have this saying, access is our wig, which really means that, we want kids to come to us, right? It's hard to get appointments at Cincinnati Children. So that's one of the big areas that we're solving. So that is the work that we're doing from a data perspective is aligned. The projects are aligned to that goal. Or the population health or the accountable care organization that I talked about, we have to stratify the kids by risk. So we have to risk stratify them so we can then assign the right resources, whether it's care management or other kinds of help or social determinants of health, that we can help to close equity gaps. So our data projects are aligned to these strategic initiatives as we move forward. So essentially, that is how I think of data strategy, as these two parallel paths that we're traveling. And I've always kind of thought about it as, there are times when there's a balance, right? It's never 50-50. Sometimes it'll lean more towards strategic priorities. Sometimes it'll lean more towards technologies. Depends on where we're headed and where we are in our journey.
And it makes a whole lot of sense being able to balance both sides of that. You mentioned modernization and cloud, and that's not just the one step. There's lots of different clouds. The clouds are constantly changing. The tools that are available are constantly evolving, and that's true in all of technology, though. It seems like in data, we're pushing the envelope, perhaps more than some other parts of IT. With all those rapidly evolving tools and techniques, how do you stay updated and decide which ones to integrate into your organization?
Yeah, it's a continuous learning, right? I mean, I actually love learning, but so that's a lot of fun. But really relying on, obviously I have my personal readings that I do like everyone else, right? Then we lean on our leaders to bring stuff to us from a priority perspective, lean on my teams. If my teams are out there, they're seeing stuff, right? We have to but then also really leaning on our partners, both internally and externally. So we have a pretty strong partnership with Gartner. So I rely on Gartner research quite a bit. Our vendor partners. So two key partners, I would say, in this space. We are a Microsoft partner and we are an Epic partner. Epic's our EMR. We're actually implementing Workday. So really trying to stay aligned with their roadmaps, what gets, how they are progressing and what are some of the things that they are developing so that we are not reinventing that wheel and we're working and we're leveraging the technology that they're bringing forth. So again, we're working with Microsoft on OpenAI and we're working with Epic as an early adopter as their generative AI features that they are trying to put in Epic. But we also want to be open to innovation. So we have a standard process that if we do think of new technology that we want to test out, we have a standard technology review process and intake process. And I encourage the teams to do proofs of concept. So we've done that. We've done that where sometimes we've kind of learned and we've said, all right, let's back shop because, we learned and it's not good for us. We're not ready for it, whether it's from a maintainability perspective, it doesn't fit in our enterprise architecture, or we scale from there. So it's a combination of how we would approach this.
That's wonderful. It feels comprehensive. One area I think that is progressing faster than some others within data is artificial intelligence. You mentioned OpenAI. Where are places, or how do you place artificial intelligence and machine learning within the hospital?
Oh, what a great question. I think I'm super excited for this opportunity to share because I think healthcare is at such a transformational place. And with AI, it seems like the technology is finally there, that it can actually help to innovate and transform the way we deliver care. And we have been doing AI, like, if you think about, we are an academic medical center. So computational medicine techniques are not new, right? We've been using that for a really long time. We've got a huge research arm, leading faculty research scientists that have been doing and developing new treatments and new drugs and new cures. But what I think the promise of AI with the technology is today is one that it can reduce the time it takes for us to go from bench to bedside. Traditionally it's about 17 years, 15 to 17 years. So I think there's an opportunity to short circuit that. There's also lots of opportunity just on the operational efficiency side. So, as healthcare is going through a change around just the reimbursement model. So we're looking at different types of reimbursement, value-based models from, moving away from fee-for-service. We're looking at, we're seeing clinician burnout, we're seeing staff shortages. So I think there's a lot of opportunity there. We're partnering with, startups. We're trying to test out something from a conversational AI perspective to see, can we automate some of those preoperative phone calls that, the call that you get before surgery, hey, do not eat after midnight, or, make sure you're there at 7 a.m. or something, right? That is manual work that we have staff doing. And I think that could be automated. So that's an opportunity that we're actually testing out. We have ways of collecting risk assessments that we make calls to our patients, and then trying to get information, automating that through AI. Generative AI, thinking about the content that we can create from a patient education, staff education. We just saw Copilot being going GA early this month. So there's just a lot of opportunity. We are also recently our research scientists have been working on a model to detect early anxiety, detect anxiety earlier for the last 10 years. And now it's actually ready to be tested into our primary care spaces. So we're doing that. We're testing out some risk stratification models. So there's just a lot of opportunity in both digital interventions as patient-facing as well as clinician productivity. And I think one thing I would add to that, one of the challenges as a pediatric organization, that because when I talk about these things, a lot of times it's like there are models already available, but they're not tested on pediatrics. So that is a challenge. And kids are not little adults. So anything we get, we have to go through a process, right, to test it. And then with that, we want to make sure we're doing it safely, ethically, responsibly. So we've actually put processes in place. We have an AI governance council, we have an AI governance framework that we're testing out and making sure that as we're deploying these models, or we're buying technology that has embedded AI in it, that we're taking it appropriate to the appropriate channels and the appropriate processes.
I love when I get a chance to work in healthcare organizations that there is an idea of the scientific method that's rooted in people, that there is this idea of experimentation, and that bringing new technology forward when we expect to learn as we're going as well. That you find an audience that's perhaps more receptive of that, as long as it's done safely, just like you said, and that we're keeping that patient front and center. Thank you, Bhavna Mehta, for joining me today. And for anyone listening, please visit cdomagazine.tech for additional interviews.
Thank you, Mike. It's a pleasure.